Care fragmentation between providers is a serious challenge, particularly in caring for patients with chronic illness. Poorly coordinated transitions between care settings has been estimated to cost providers as much as $45 billion annually. More importantly, fragmentation of care negatively impacts the patient experience and treatment outcomes. Elsevier is the only company to offer longitudinal care plans that are entirely patient-centric, holistic, evidence-based, and integrated. They focus entirely on a patient's story across disciplines, populations, and settings. This focus dismantles the care silos that frequently occur between disciplines and promotes coordinated interprofessional care across the continuum. Elsevier offers a comprehensive library of 500 inpatient and 60 ambulatory care plans. Our care plans are structured to include obtaining patient information through the patient profile, setting up individualized patient goals, visualizing the patient care summary, and supporting the professional exchange. Elsevier Care Planning was recognized by CLAS as a category leader in both 2017 and 2018. Mrs. Elliott's patient profile is created when she arrives in the ED with a head injury. The ED nurse talks with Mrs. Elliott to establish clinical and patient goals. This gives providers a clear sense of the patient's preferences and sets the direction for clinical treatment. In Mrs. Elliott's case, this involves two detailed care plans, one to treat her head injury, preventing further falls, and another to help her cope with her oncology diagnosis. Both plans offer specific clinical guidance as well as associated documentation that ensures her care is standardized and evidence-based. This also helps providers achieve regulatory and compliance goals. Next, care summaries are used to document findings from each intervention and patient assessment of Mrs. Elliott. The care plans are also integrated with Elsevier's clinical skills, allowing nurses to review procedures and assessments on the required skills before delivering care. When Mrs. Elliott is discharged, her nurse accesses Elsevier's patient engagement solution for content to help educate Mrs. Elliott on appropriate home care. As Mrs. Elliott transitions to the ambulatory setting, a professional exchange report is created. This supports her ambulatory care team by providing a holistic view of Mrs. Elliott's history and her clinical information. When Mrs. Elliott visits her primary care physician, her nurse administers a wellness screen, and her scores indicate anxiety symptoms. Care planning is then used to provide clinical guidance around enhancing Mrs. Elliott's coping skills and managing her emotions. Care plans improve communication and give clinicians, allied health professionals, and medical assistants clear guidance to support coordinated care across the continuum.